Good morning, Chris Ohl, Infectious Diseases, Wake Forest Baptist Health. So the week before Christmas, and I don't know if it's as quiet as a mouse, but it's been a busy week. Just a little bit on COVID activity across the country. Cases continue to occur. Records are broken every day for new cases. Still, it's the Midwest, the middle section of our country, that's kind of leading things. Here in North Carolina, our cases went up fairly considerably last week and seem to have plateaued, at least from the last 4 or 5 days' data, and actually may have gone down over the last couple days, a small amount. We'll have to see if that continues to play out. If it does, then we would have had a small bump, or a large bump as it were, in cases over last week, and that would have been related to Thanksgiving and Thanksgiving activity. And so we'll have to see how things go as we get into our Christmas holidays. The percent positives in our region is also stabilized. It's running between 11 or 12% on the state's dashboard. Hospitalizations continue to go up a little bit, but maybe stabilizing a tad bit. And hospitalizations lag behind case counts by about 10 days or so. So it would be consistent with what we were seeing in cases. A couple of things notable about this week. First of all, our first home COVID test was approved. And this is a test that you can do your own nasal swab at home, and then you process it with some little reagents that come in the kit. And then you use an app to actually read the test. And then when you read the test with the app, it automatically reports it to the counties and states, so we can keep track of our positive cases and our negative cases from testing. So how well does it work? I'm not sure yet. I haven't seen enough information and data yet to know. The data submitted to the FDA seems like it's about the same as other antigen tests, or the so-called rapid tests that are done in physicians' offices, but it would be the convenience of doing it at home. I do have a couple of concerns about home testing because it's not the test that creates the interference with transmission of COVID. The test has nothing to do with it. It's quarantining and isolating yourself after testing positive. So if people are going to be home testing, we're going to have people doing what they're supposed to do, and that would be 10 days of isolation if their test is positive, and the family members or the people living with the person who tests positive at home will need to quarantine either for 14 days or 10 days, depending on their situation. So if we don't do that part, then testing at home doesn't mean much. The other thing about testing at home that worries me a tad bit is that there's a myth that I hear all the time. Hey, I tested negative, that means I can go out tonight and have dinner, right? Or I tested negative, I can go out on an airplane and visit my family. And a negative test just means you're negative right then. It doesn't mean that you won't turn positive later in the day or the next day after exposure. So if you're testing, you still need to wear your mask, and you still need to personally distance, and you still need to do your hand hygiene. So the test result doesn't affect that. So the other big thing, obviously, this week was vaccines. So we got our vaccines at Wake Forest Baptist Health, and I think most of the county, other medical societies get, or medical centers get them today. And the county, I think, gets theirs today too, or roughly right around now. So I got my vaccine on Tuesday, and so far so good. I don't play tennis, but if I did, I think I'd be able to have a pretty good backhand. It's maybe a tad bit sore if I think about it hard, but certainly no more than a flu shot, and maybe even less. So the expected events of soreness and fever are a little bit more common after the second shot. So I'll be getting my second shot on January 5th, which is 21 days after the first one. We'll have to see how that one goes. But the expected events of some arm soreness and maybe a fever in 10 to 15% of people is easily treated with ibuprofen, Motrin, Tylenol, and other over-the-counter agents. So I'm not too worried about it. The other thing about vaccine is, so as you probably have already found out, we're vaccinating healthcare workers first, and then within our own healthcare systems, we pick the people who are the ones who are out on the wards or in the clinics seeing COVID patients, and then we'll be doing the other forward-facing patient care healthcare workers, and then working our way down the priority lists internally. A lot of healthcare workers to vaccinate. It's going to take a little bit of time. And I would suspect most health systems will be done probably the latter part of January. So if you're a healthcare worker and you haven't got your vaccine yet, a little bit of time, be patient, and it'll be coming soon. We have these two things coming up in the next 2 weeks called holidays, Christmas and New Year's, and they're also obviously we won't be vaccinating on those days, so it kind of gets in the way a little bit right now. A couple of glitches with the paperwork part of vaccination, and it was not unexpected. So the state and the government has an informatics system that keeps track of every dose and who is vaccinated, and where and when. And one of the reasons for doing that is so that we can make sure the second dose is available for them, so that the state will have that vaccine as they distribute it out to their counties and to their health systems within the state. So that system, emailing system, got a little overwhelmed. So the registration emails have been a little late for some of our healthcare workers, but I'm pretty confident we'll work that out in the next few days at the state level. And once that registration email is done, then individual hospitals or county entities will then contact people to come in to get vaccinated, and that will be done through email too. So the big ramp up, I think, will be next week after a lot of the piloting and adjustments are made. So I was going to take a few questions about vaccine, and then we'll go from there. And then we'll open it up to the room for people who have questions. So, Bettina wants to know, will organ transplant recipients such as heart, kidney, and lung be getting the vaccine? Great question. Actually, having had an organ transplant is a really good reason to get the vaccine. So it's not a live virus vaccine, so we can safely give it to people who are immunocompromised. And even pregnancies, technically, you could give it to. But if you've had a heart, kidney, or lung transplant and you're on immunosuppressive treatment to keep you from rejecting the organ, and that means you have a higher risk of hospitalization or severe COVID. And so that is a great reason to get the vaccine. There were some immunocompromised people included in the trials, both for Pfizer and Moderna's vaccine, and they responded pretty well to the vaccine. So that's good news, actually, for that group of people. Lynn asks, does the vaccine prevent the transmission of the virus, or does it keep the person from getting the virus? Or does it only keep the person from having symptoms, or all of the above? That is a fantastic question, and we don't totally know the answer yet. And let me explain the question a little bit. So the way you get COVID is, for the most part, you inhale droplets from the air that's directly from another person, usually within 6 feet, sometimes a little longer. And then that gets into your respiratory tract, and then it works its way down through the respiratory tract down into the lung, where it attaches to receptors in the lung, and then it causes the infection and the disease. So it's an important thing. Does the virus work at the stage of it causing the disease in the lung, or does it work on the stage of the virus moving down from the nose and the upper airways into the lower, or does it actually keep you from picking up the virus from other people? It's probably a little bit of the above, but I think that we're going to find out, that people can be transiently colonized with the virus in their upper airways after being exposed, but it just won't do what it needs to do to cause disease, because you're immune and your antibodies attack it. But you may still be transiently colonized, and so it could be possible that you could transmit it to another person. We won't know until we have more experience with vaccinated people and virus transmission through doing contact tracing. But that's the reason why after vaccine we still need to wear a mask, and we still need to personally distance, and we still need to do all the hand hygiene. None of that's going to change. So as I talked about last week, kind of the analogy, you could, one of them anyway, is that you can think of yourself as a virus going to do a mud run. And if you wear your mask and you personally distance, it makes the mud deeper, so the virus can't move as quickly or as easily from person to person through the mud run. If you get vaccinated, it makes the mud thicker. And then the more people who get vaccinated, the thicker and thicker the mud works. And so the virus slows down, and finally it just can't transmit anywhere more within the population of people. So it's vaccination plus masking plus personal distancing. The three of those things work together synergistically and make it a stronger weapon against the virus than any of those alone. So we need to keep doing that. Polly asks, what are the differences between the Moderna and the Pfizer vaccines? Is one better than the other, and will 2 doses need to be administered? You know, actually, there's not a lot of differences between the 2 vaccines. They're both messenger RNA vaccines, which is the nucleic acid template for making the spike protein that then our body reacts to by making antibodies, and that's how the immunity comes about. So they both have the same messenger RNA actually in it. The capsule that encases the messenger RNA is a little bit different between the 2 vaccines, but both of them are there to facilitate uptake of that messenger RNA by our tissues and cells in order for the protein, the spike protein, to be made to cause the immunity. Pfizer's vaccine, through their testing, they found out it's most stable if kept at minus 80 degrees centigrade, so you need those potent freezers. Moderna's vaccine, their testing says that they only need minus 30. And it can be kept in a refrigerator for a little bit longer than Pfizer's vaccine. So that's really about the differences. They both work about the same, 95% efficacy, and the trials were performed pretty much the same way. So we're confident about their safety record between the 2 vaccines. And the expected events of soreness and fever, probably about the same between the 2. And both of them had no serious safety concerns in the clinical trials. Both of them were studied with 30 to 40,000 people in the trials, so, which is about the number that we use for when we're making any new vaccine, a new flu vaccine, a new shingles vaccine. That's about the same number. So there's really not a heck of a lot of difference. Both do need 2 doses. Pfizer's vaccine, it's 21 days between them. Moderna's, it's 28 days. So not a lot of difference there either. Sharon asks, with people who are allergic to penicillin and everything that derives from it, is there a chance that group may have a greater chance of side effects? Well, so, you know, so far in vaccination, there's been, with Pfizer's vaccine, three people, maybe 4, in the entire world who had allergic responses afterwards. The majority of those were in people who had a history of allergic responses to vaccines or to multiple other products. So we're not talking about like a penicillin allergy where you get a rash. These are people who have problems breathing or low blood pressure after getting stung by a bee, eating peanuts, getting in contact with shellfish. These people know who they are because they are usually seeing allergists regularly and carry around EpiPens. So those are the people that that could potentially have an allergic response to the vaccine. So I mean, I do travel medicine, tropical medicines, and I have a vaccine clinic. So I've given tons of vaccines in my life, and those allergic responses are really, really, really uncommon. When I was in the Navy, we used to see one every now and then, but we were vaccinating tens to hundreds of thousands of people, so they're very uncommon. Having an allergy to penicillin itself, unless it's something called an anaphylaxis reaction, which is about 1 in 300,000 people, shouldn't be a concern. And we watch people after vaccination for 15 minutes, and if you've had a history of anaphylaxis to anything in the past, we watch you for 30 minutes afterwards. So you just need to let your vaccinator know. But this is something we run into with vaccines, and the COVID vaccines are looks like no different that way. Brianna wants to know, will our local hospitals require that staff receive the vaccine, or will it be voluntary until more long-term research is done? Yeah, it's voluntary right now. There will mandates for getting vaccinated, I think, are going to be a ways off. So, you know, we actually require us healthcare workers to get vaccinated for certain things like hepatitis, measles, mumps, chickenpox. So we require that. That's for both for the protection of the healthcare worker and for protection of the patient. So it wouldn't surprise me that if somewhere down the road we require a COVID vaccine for everyone, just like we require flu shots every year for people. So I think at some point down the road it will, but we want to see more how things go with the vaccine, how long the immunity is, how robust that immunity is. And what the side effect profile is as we go down the road longer. So I don't think places will be mandating it for a while yet. So usually we don't do that either until the ACIP, which is the CDC's advisory committee, or other professional societies recommend it. So it'll be a little while yet. Jennifer wants to know, is there any data on people contracting COVID more than once? Also, are we seeing fewer than normal flu cases so far? Well, the second part of the question first, about flu cases, yes, we are seeing a lot fewer flu cases this year. And one reason is this, the mask. It protects you from COVID, and it protects you from transmitting COVID even more. But any respiratory virus is going to be hindered by the mask, and that includes influenza. So the flu. Also, more people got vaccinated for flu this year than any other year. So there's more vaccine out, and people. So far the season's been a lot milder. About I'm trying to remember the exact data that I saw. Probably somewhere between 5 to 10 times milder this year. So that's good news. So masking works, even for other things than COVID. The first part of the question, is there any data of people contracting COVID more than once? Yeah, we do have some sporadic case reports of that happening. It seems to be unusual and not common. Usually it's people who had a milder infection the first time. And there seems to be a rule with COVID that the more strong your first infection is, the more symptoms that you have, the more immunity you build up, right? Your body's reacting to it, so it kind of makes sense. So the people sometimes who've had really mild cases, maybe just a loss of sense of smell, maybe just a little tiredness, headache, and it got better in a day or two. A few of them, a small number, have had evidence of having COVID a second time. Now we see that with other viruses as well. Other respiratory viruses, so it's not unexpected. But most people appear that they have immunity after getting COVID and don't get it again, most people, and that immunity we know so far lasts at least 3 months, maybe longer. We need a little further out to have those studies done. So now, if you've had COVID before, should you get the vaccine? And the answer is yes, because let's say you had COVID, you had a milder case, your antibody level came up to here. If you get the vaccine, we're going to boost you, then the antibody comes up to here. So you're going to have a much more robust immunity for COVID. So also to try to do all the testing and stuff to see if you really had it and what your immune level is, it's a little arduous, takes time. It's easier just to get the shot. And I, as a healthcare worker, whenever I change jobs or go to a new place or whatever, everyone wants to know, are you immune to measles? You can either get a blood test or you can get the shot again. I always just get the shot again because it's easier, and then I don't have to go back if the test is too low. So people who've had COVID before should get COVID. If you've had COVID in the last 3 months, you might want to wait and let some other people in line cut in front of you because you're probably immune, and so if you wait to the end, then other people who haven't had COVID get a chance to get vaccinated first. So it's just being polite and kind, I guess. Eileen asks, with the record speed of vaccine development, is the scientific community confident there'll be no long-term side effects that haven't showed up in studies yet? I think yes. I think we are pretty confident. I am. I mean, I've looked at the data for both Moderna's and Pfizer's vaccine, the data they submitted to the FDA, and there really were no serious side effects. Yeah, your arm might get a little bit sore, and 10 to 15% may have a fever the day afterwards, but it doesn't last more than a day, and it's easily treated with over-the-counter stuff. So between Moderna and Pfizer, it's almost 100,000 people now have been in those clinical trials. So when you say with record speed of vaccine development, so what determines when a vaccine is ready to come out of a trial and ready to go to production? Isn't the length of time you've been studying it, it's the number of people that you've been studying it in. And so the trials for Moderna's vaccine and Pfizer's vaccine included the same number of people that we normally would. And why were we able to get so many people into the trials? One, is there a lot of people had interest in being in the clinical trial, and two is that the government poured a lot of money into recruiting people into these trials. So we got the numbers that we needed fairly quickly. So that doesn't give you any shouldn't give you any concern about safety, because it's the numbers in the trial, not the length of time the trial went on. Shannon wants to know, there are some concerns about fertility issues with the vaccine. Is there any data about this? So I really I can't fathom why this vaccine would have problems with fertility, because the biology just doesn't make sense that this vaccine would interfere with fertility. Is there any knowledge from the trials? Well, we would need to have a longer follow-up to know for sure, but I have no concerns at all about fertility, and we don't have any, I mean, we've never made a vaccine that's had fertility issues, so I really don't think that's going to be a problem, actually. And there's no problems with fertility from having COVID either, so it's not the spike protein. So I don't think it's an issue. Michelle asks, what happens if you get the vaccine but you have the virus without knowing it? Nothing. You still develop an immune response, and it's not going to hurt you. Having asymptomatic infection at the time of vaccination is not a concern. Vaccine's still going to work the usual way. In fact, may even get a bit stronger of an immune response out of it. So that's not an issue. So you don't have to get tested before you get vaccinated. But do wear your mask as you go to the vaccine center. We want to stay personally distanced, even when getting vaccine. Does the vaccine alter your DNA? No, the messenger RNA that's picked up in your tissues, it degrades, just like all messenger RNA will, and so it doesn't enter your DNA. RNA can't enter DNA anyway, so it doesn't alter your genetic makeup at all. So no concerns there. Can 10 people safely get together at Christmas if everyone wears a mask the whole time and stays 6 feet apart? Yes, Christmas is just right around the corner. 2 days ago, I actually looked at the calendar to find out when I was going to need to get my second shot. And then I looked and I said, man, Christmas is next week. How'd that happen? That's just not fair. So, so Christmas time, the safest way to get through Christmas and the best way is to have a small, intimate family event with people who are in your own bubble and enjoy the holiday. If you're going to have visitors or you want to visit, the number of people is directly related to risk, because I call these bubble fusion events. You have your own bubble and that which is your own exposure history and risk, and you have another person's bubble, and when you get together, particularly if you're not personally distanced or masked, those bubbles fuse. So if you got 10 people over, you have 10 bubbles that are all fused together. So obviously that increases your risk of being exposed. And so if you're going to travel or have somebody travel to your house, keep it small and the number of bubble fusions small. And people who have real high risk of getting severe COVID really shouldn't be involved in this. When you do this, try to keep your outings outside. Time for the fire pit or the heat lamp, or be out on the screen porch, put some blankets on. Outside is much better, and be masked. You should still sit 6 feet apart. So as you're opening presents around the Christmas tree, if there's somebody who's not in your bubble, they need to be doing it 6 feet away from you. And then you should be masked. Everyone should be masked when that happens. So Melissa asked, my son and daughter-in-law have both had COVID. Is it safe for them to stay with us over Christmas? Well, I think we just talked about that. Since they both have had COVID, that reduces the chance that they could bring COVID into your hospital, but it doesn't reduce it to zero. Because as we talked about, I think sometimes people can get transiently colonized, even though they're not going to get sick with it. It could be hanging out in the back of their throat. Probably not for long, but it's possible. So you should still, with your son and daughter-in-law, they should stay masked and try to distance, even though they've both had COVID. I know it seems a little bit odd, but that's the safest way. So any questions from the group here?
touched on it a little bit with the fertility issue, but I think some women who are pregnant and or breastfeeding are concerned a little bit about vaccine.
So pregnancy or breastfeeding. So because it's not a live virus vaccine, it should be safe in pregnancy and for breastfeeding women. The trials, like most trials when they do them, they don't include pregnant women. This just has to do with liability concerns on part of the vaccine manufacturer. This has been discussed by the American College of Obstetricians and Gynecologists, ACOG, and they suggest that women who are pregnant discuss this with their obstetrician about getting vaccinated. Because there's a risk-benefit ratio that should be considered, and the expecting mom should be think about it and decide where they sit on that decision. So, and the reason why is that pregnant women do have a greater chance, if they get COVID, of having more serious infections. So their hospitalization rate is higher, and their ICU stays rate is higher. So pregnant women do have a greater risk of getting more severe COVID. It's not a hugely higher, but it is higher. And so getting vaccinated would reduce that risk of having severe COVID. ACOG, the obstetrics group, says that you should wait till after the first trimester. And we don't really recommend vaccines during the first trimester for any vaccine. So we always wait until the second trimester. So wait until the second trimester, and when you get vaccinated. So each expecting woman's going to need to have that discussion with their obstetrician, talk about it with themselves and their partners, and make that decision. As time goes on, all of the women who get vaccinated who are pregnant will get entered into a registry. And as time goes on, we have more and more and more experience with vaccinating pregnant women, and the registry will show us the safety data with that. So that's where pregnancy goes. Breastfeeding, is sort of in the same category but breastfeeding actually, the way it works, so if you get vaccinated and you're breastfeeding, that means you make antibodies. Those antibodies actually cross the placenta. Your own antibodies, your own immunity crosses the placenta, so when the baby's born, the baby will be immune to COVID for 3 to 4 months from mom's antibodies, just from those antibodies being in the breast milk. So if you get vaccinated during pregnancy, you will be in effect vaccinating your child for 3 months because your antibodies cross. And then when you're breastfeeding, there'll be some antibodies in that breast milk that'll also help protect the child. So I really couldn't see how breastfeeding would be a problem, actually. In pregnancy, it'll be a decision what you feel your risk is for COVID versus how much you want to be protected. So.
Now, is this vaccine, doctor, is it going to be, I know you have to get 2 doses, but is it a one-time thing, or is it going to be something like a flu shot where we have to get a flu shot every year?
So, well, we need to be boosted by the vaccine every year or 2. Well, we don't know yet, because we haven't gone out that far. So we'll have to wait and see. My personal feeling is that the immunity should be fairly long-lasting. So how long-lasting, we'll just have to find out. I think it's going to be long enough lasting to get us out of this pandemic. I'm pretty sure of that, actually. But, we get boosted with a lot of other shots, right? You get your tetanus shot every 10 years. kids get a booster vaccine for whooping cough at adolescence, and then we get it again as an adult. Meningitis vaccine needs to be boosted every 3 to 5 years. And so, in fact, most vaccines need to be boosted. So it wouldn't surprise me that if this one wouldn't either, but we'll just have to figure out what the interval is, how many years until you need it. You know, which also brings up the question, you know, how is COVID going to exit our world? Well, the pandemic will end, and with the combination of masking, distancing, and vaccination. And then the virus will probably just kind of retreat into that background of respiratory viruses that people can potentially get every year. And because you've been vaccinated or had the disease before, it won't be as severe the next time you get it. So that it'll just enter into that sort of background. So I think we will be continuing to vaccinate people because the virus will never 100% go away. But I think after this year, the pandemic aspects of coronavirus will be over.
There was a question about how many doses were in a vial.
Oh yeah, how many doses in a vial?
I was wondering what your thoughts were.
Yeah, so it turns out that on Monday and Tuesday, when we all started getting our vaccine and giving doses, we see, you know, we pulled 5 doses out, and there was still a little bit of vaccine in the vial. And so, in fact, it was enough for another dose. So a bunch of us ID doctors asked Pfizer, you know, hey, you know, there's more than 5 doses in a vial. Can we use that last dose? And they said, yeah, they tested it and it's good. So we got a little bit of an extra bonus in our Christmas present of vaccine shipment. So there's most vials have 6 doses in them. And why Pfizer overfilled a little bit, I don't know, but you know, we'll take it. So it just means with the shipments that we got will last a little bit longer. But yeah, that extra dose is the exact same stuff, so it's all good. So.
And lastly, there was a report that I saw last night that in Alaska, either Anchorage or Juneau, there was a healthcare worker that had a serious reaction.
Yeah, well, I looked at the reaction of that person up in Anchorage. So, I mean, serious is sort of in the eye of the beholder. She flushed, and her pulse rate went up a little bit. She got the epi shot because we keep the epinephrine, you know, when we vaccinate. Every shot clinic in the country has epinephrine available to use. You have to if you're giving shots. So she got the epinephrine, and then she was fine after that. They kept her overnight just to watch her. And so how serious it was, I don't think she was ever in danger.
It was basically just what you said. I mean, she went to the ER,
yeah,
and got the epinephrine.
Yeah, it's not. It's just something that we are used to doing. We have been doing for 50 years of giving shots.
I think the
in
thing
the
though
US.
is, you know, people are already on edge about this.
Yeah.
So whenever something like that happens, as normal as it may be for you as a doctor, the general public doesn't see it.
Yeah, well, I want people to know that, you know, it's something we always plan for. Any shot you get, we plan for this. We watch people after their shots. That's why people sit for 15 minutes after getting a shot, and that's just part of giving shots. And so, but yeah, the public should be reassured that I don't think it's going to be a big issue actually. You can get it after your Shingrix shot. So anyway.
I was curious, you know, the virus has, the past month or two has really gotten bad. You know, rates have been records every day here.
Right.
And I don't know if you can really say what has been causing it. It's just because of the winter months coming on.
Yeah.
And I've got another question after that.
Okay, so the question is why is the second wave happening? Why are we having so many cases now? The reason is really it comes down to us as a society and our communities. I think part of it's COVID fatigue. People are tired of personally distancing. They want to be social. Holidays have come around, and during holiday time, people want to socialize. They, it's like, hey, 8 people from the workplace. We've been working together for 2 years. We've been working hard. Let's all go out and get lunch. When you're eating, the masks come down, and transmission can occur. And then family visits is another one I hear a lot about. Crazy Uncle Eddie comes down to visit the family, brings COVID down with his RV. These are sort of the things. So it's us, it's our own behavior. Also, we're inside a lot more. I mean, it's colder outside. So when we have activities, instead of having a barbecue out on the back deck and hanging out outside, people are more inside, and that results in more transmission. And then there may be a little bit about the weather itself, where the virus tends to hang out longer in the air when there's not as much UV light, so not as much sunlight around. And then also it tends to hang out a little longer under colder conditions and less humid conditions. So I'm not sure about the less humid. I mean, here in North Carolina, we seem to be having a lot of rain and humidity still, but those are all the reasons, I think.
And another thing, kind of the same thing. I was just curious: would it be also because maybe has the virus changed, gotten stronger, or mutated? Or?
Yeah. So could it be that the virus has mutated or changed? It doesn't seem to be so. People are really trying to keep track of that. Our virologists out there are constantly sequencing it to see how many mutations have occurred in it. And like all viruses, as they move through a population, they change a little bit. So far, the changes in the makeup, the RNA of this virus, have been such that it hasn't affected its transmission or its virulence. Virulence being its meanness. So that doesn't seem to be the problem. Yeah. Something to keep an eye on, but so far it hasn't been an issue. So. All right, next week, Christmas Eve. So maybe we'll take Christmas Eve off, but I'm happy to come in on the morning of New Year's Eve. And so let's plan on taking next week off. So my staff here and reporters can spend some time with their families safely and in a distanced and masked way. So, all right, see you in 2 weeks.